People ask me all the time, hey doc, should I get a routine stress test? And for almost everyone, the answer is it's a flat no. Even if your doctor is the one sending you for it, recent studies show that up to 50% of these tests are just not necessary. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, like, share, and follow. To get a stress test, you need a clinical reason. Something like chest pressure, shortness of breath on exertion. But it can't just be a random symptom. It requires a real story. It requires a history that a doctor actually sits down and takes the time to document. And honestly, doctors often have to fluff up the documentation just to get these tests approved by insurance because the clinical data often doesn't support them. Have chest pain? How about if I push on it? Maybe if I, any chest pain there? That I got chest pain, doctor. But what I'm really saying here is, why am I so against it? Because stress tests aren't perfect, and nuclear ones even expose you to radiation. Now, the stress test can be wrong. In fact, in people without a clear medical reason to have one, a stress test is more often wrong than right. A false positive starts a dangerous domino effect. It leads to a cardiac angiogram, which involves more radiation, invasive entry into your arteries, and huge costs. Then you might end up with a stent you maybe never even needed. The data is clear for people without symptoms, especially when we're talking about less critical arteries. Most studies show that patients actually do better with medical management, like statins and blood pressure medicines, than they do with an invasive stent. So do you really need that stress test? For the vast majority of you, the answer is no. Don't go looking for trouble that isn't there. Stick to risk modification first and only get a stress test when needed. I'm Dr. Evan Levine. I hope I'm helping some people out there. Thanks so much for watching.